Parents tell us every single week. We have been to every specialist, we've run every test, but nobody can tell us why our child is struggling. That blood work is normal. MRI, clear as can be. EEG, there is no seizure activity. And yet your child is still dealing with chronic ear infections, speech delays, sensory meltdowns. You've got focus challenges, sleep struggles that just won't quit. Here's what's happening. The traditional pediatric medical system is trained to look for a thing called pathology. They're asking, is something seriously wrong? But they're missing a far more important question. How well is your child's nervous system actually functioning? Now, your pediatrician, they track height, they track weight at every visit. But what about the system that controls digestion, immunity, sleep, behavior, emotions, coordination, and most importantly, that's up for you to decide, their development? What about the air traffic controller running the entire operation? That's where the Insight scans come into play. And for thousands of families, this was the first test that actually gave them answers. This video, I wanted to make it for you parents who are exhausted from collecting diagnoses. For the parent who has been told they'll grow out of it, let's just wait and see. It's probably behavioral, but deep down, you know something isn't right. You don't want another label. You want understanding for what's happening underneath it all. Let me share with you a story about a baby that we'll call Braxton. He was just 1 week old, and his parents were absolutely terrified. Every time they laid him on his back, he went into uncomfortable spasms. Specialists, they were talking about seizure evaluations, infantile spasms, EEGs, hospital visits. They were bracing for the absolute worst. But before the hospital EEG appointment, they came in here for Insight scans. What we found wasn't seizure pathology. It was a nervous system locked in stress mode. Now, baby stress had left his body, Braxton's body, stuck in fight or flight. He couldn't calm, he couldn't coordinate, and after just the first week of gentle, specific adjustments, those spasms, they stopped. And when they finally had that hospital EEG visit, well, it was completely clear. That's the difference between looking for disease and actually being able to measure function. Now, with the traditional medicine, what they miss here. Blood work looks for disease markers. MRIs, they look for structural damage. EEGs, they look for seizure activity. All important tests, they are. Please don't get me wrong there. That's not what I'm saying. But they all ask the same question. Is something broken? And here's the problem. 1 in 12 children in the U.S. has a speech or language condition. And the vast majority of them have completely normal MRIs and labs. Nothing is damaged, but that doesn't mean everything is functioning properly. Now, the nervous system is the air traffic controller for your child's entire body. If it's stuck in stress mode from prenatal, tension, birth trauma, early illness, or chronic overload, everything downstream struggles. And traditional exams, they don't measure that. Insight scans do. Now, there's 3 Insight scans. We use all 3, and they work together to give us a complete picture. Number 1, there's the neurothermal scan. This shows us how stress is affecting digestion, immunity, and organ function. This is where we often see patterns behind reflux, constipation, frequent ear infections, and chronic illness. Now, number 2, we've got neurospinal EMG scans, okay? These measure muscle tension and stress patterns in the spine and the nervous system. This often explains developmental delays. You've got sensory struggles, coordination challenges, and focus problems. And the third one is the HRV scan, or heart rate variability. These show us how well your child adapts to stress, if they struggle with transitions, emotional regulation, sleep, anxiety. These scans usually tell us why this is happening. And together, these 3 scans show us what no blood scan tests can. They show us how the nervous system is functioning. And the patterns that we see, You've got the EMG scans. They often reveal two major patterns. We call them raging bull and drunken bull. The raging bull means that the nervous system is stuck in overdrive. Anxiety, hyperactivity, poor sleep, big emotional reactions. Their system, it can't shut off. Now, a drunken bull shows disorganization. You've got poor coordination, low tone, focus struggles, sensory challenges, learning delays. Now, most kids we see have a mix of both, and almost always there's been a perfect storm. We're talking prenatal stress, birth interventions, antibiotics, early illnesses. You've got environmental overload, and just that stacked stress that just keeps happening. And over time, that nervous system adapts the wrong way. But here's the good news. Kids aren't stuck like this. When the nervous system balance is restored, those scan patterns, they change. And so does their health. And here's why this changes everything. Those insight scans replace guessing with data. They show us exactly what's happening. They show us exactly how severe it is and exactly how it's changing over time. Sometimes therapy, it feels like pushing a car with the parking brake on. You are doing everything right, but that progress, it's slow. And when scans show dysautonomia or a nervous system stuck in stress mode, it explains why therapies stall. And when we restore balance, suddenly sleep improves, digestion improves, that behavior stabilizes, focus, it sharpens, and we don't just feel it, we rescan it from day one to day forever for your child. So if you're tired of hearing wait and see, if you're tired of collecting labels without getting answers, insight scans may be exactly what your family needs. And your child, they deserve more than symptom management. They deserve a nervous system functioning at its full potential. I invite you, click the link in our bio. You could send our team a DM or schedule directly with our team here at Live Better Chiropractic in Sterling. Let's stop guessing and let's test what actually matters and help your child to truly thrive.